Hi everyone, this is video 8 which covers labels and injections for math and dosage calculations. The content topics covered on this video will be reading labels, reconstitution of medications, syringes, and insulin injections. Reading labels. The labels shown on this slide help us better understand the name, dose, and adverse effects of the prescribed medication ordered for the patient. For example, the label on the left upper corner states the patient's first and last name, the dose to be taken, which is 1 tablet by mouth twice a day, the name of the medication, the dose per tab, and the doctor's first and last name. Reading labels is key when calculating a math dosage question and, most importantly, to give the correct medication prescribed to our patient through the right route at the right time and for the right reason. For example, the question above gives us the order prescribed by the physician and the supply in each tablet. The order by the physician is to give 60 milligrams of furosemide by mouth daily, and it is supplied in 40 milligrams per tab. The question asks, how many tablets will the client receive per dose? Since the question is asking for tablets, we start with 1 tab is equal to 40 milligrams, and the order is 60 milligrams per dose. Milligrams then cancels out, and we're left out with tablets. We then divide 60 over 40, which gives us 1.5. However, it is important to remember that with tablets, we don't use decimals and instead we use fractions, which gives us the answer of 1 1/2 of a tablet. Reconstitution of medication. Some medications are prepared in a dry form, powder, or crystal. As liquids, they are unstable and lose potency over time. The drug must be reconstituted according to the manufacturer's directions, which will give the type and amount of diluent to use. As stated in this label, the medication is 1 gram as a dry powder, but when reconstituted, it is 325 milligrams per milliliter. Example. Label gives us information such as the order, supply, desire, conversion factor, which ultimately gives us the answer. The order is the sulfonazid sodium 0.65 grams IM every day. Supply or half is 1 gram as a dry powder when reconstituted. It is 325 milligrams per milliliter. Desire is 0.65 grams. And a conversion factor of 1,000 milligrams per 1 gram. Question is, how much liquid to give stated as ml? For this question, we start with 1 ml is equal to 325 milligrams. 0.65 grams is equal to 1 gram, is equal to 1,000 milligrams, which gives us 2 mLs. Keep in mind that extra information will be added to throw you off, so make sure you understand and carefully read the information. Oral liquids. The label presented also shows the name, dose, reconstitution, and directions when using. For example, the physician ordered 0.5 grams of Zithromax 4 times daily for 3 days. What is the amount to administer? As stated on the label, supply is 5 ml is equal to 200 milligrams. The order is 0.5 grams is equal to 1 dose. And the conversion table is 1,000 milligrams is equals to 1 gram, which gives us 12.5 milliliters per dose. This slide shows various images of the anatomy of the syringe. the different amount that can be given through the syringe, the different types of needle sizes distinguished through color and gauge size, and lastly, an image of the insulin syringe. It is of great importance to always use the correct syringe on the correct patient. Insulin injections scenario. Humulin N 30 units subcutaneous, regular insulin subcutaneous injection AC and HS per sliding scale. On hand, Humulin N 100 units per ml, regular insulin 100 units per ml. This slide presents various blood glucose readings and the insulin dose to be given as per sliding scale. Question A asks, the patient's blood glucose reading before breakfast is 288 milligrams per deciliter. How many units of insulin will the patient receive based on the sliding scale? Blood glucose is 288, which falls in between 251 and 300 milligrams per deciliter, which means we will be giving 6 units to our patient. Question B asks, what is the total amount of the insulin the patient will receive this morning? For this question, we will be adding the 30 units of Humulin N plus the 6 units given to the patient before breakfast, which equals to 36 units in total for the morning. To add, remember that Humulin insulin tends to take effect slower than insulin analogs. Insulin analogs can start acting in as little as 5 to 10 minutes after injection. Regular human insulin takes about 15 to 30 minutes to start working after being injected. To conclude, always remember you're not studying to pass the exam. You're studying for the day, when you are the only thing between the patient and the grave. Don't ever hesitate to ask any questions. Please read disclaimer.